Well, good evening, everybody. My name is Betty Chu. I am the Senior Vice President, Associate Chief Clinical Officer for Henry Ford Health System. And I'm joined today by a really great panel of participants around our Youth and Vaccines webinar, and I'll introduce our participants in just a minute. Just a few items that I want to make sure that folks know. We do hope to be able to answer your questions, so feel free to provide your questions in the chat box this evening. We're also recording the webinar, and we'll be sharing this webinar through the Henry Ford Health System YouTube channel for the public. So I really wanted to encourage the importance of you sharing this information. And also today, of course, we want to share the importance of vaccination. We really wanted to focus on youth and have this special webinar, having all of our kids with us today to really talk about the importance of vaccination in our young people. As many of you know, the FDA has approved Pfizer for use in youth ages 12 to 15 on May 10th. And it was previously approved for kids 16 and over. And the vaccine's widely available for use. At all Henry Ford Health Systems vaccination sites and community vaccination sites offer the vaccine to children 12 and over. And you can self-schedule vaccines online at www.henryford.com/vaccine and also find a wealth of information there. And this webinar, of course, will be posted there in the future. We expect, of course, other vaccines to be available for approved in the future. We'll be talking a little bit about that today. And we expect that the vaccines will be available for children younger than 12 in the future. So hopefully we can get all of our children protected in the near future. Of note, we also want to make special note that there is no waiting period between the COVID vaccine and other vaccinations. There's certainly a lot of really important pediatric vaccinations that all of our kids need. So we want to make sure that everybody's aware on the front end here that you can get that COVID vaccine and not have to worry about it interfering with other vaccination schedules for your kids. So with that, I first wanted to introduce the panelists today. I have to my left my son Aiden Shoresh, who is 16 and currently a 10th grader. I've got with us today Dr. Tisa Johnson-Hooper and her daughter with her, Madeline, who's 12 years old and I believe in 7th grade currently. Is that correct? Dr. Tisa Johnson-Hooper is the medical director for the Center for Autism and Developmental Disabilities. She's also the interim chair for pediatrics at the Henry Ford Medical Group. She's a board-certified pediatrician with more than 20 years of experience, and she sees patients at New Center 1 and our New Center 1 site. We're also really fortunate to have with us Dr. Dennis Cunningham and his son Brett. Say hi, Brett, who's 14. Hi. And he'll be starting the 8th grade next year. Dr. Cunningham is our system medical director for infection control and prevention. He's board certified in pediatrics and infectious disease with a fellowship training and specialty around a lot of clinical trials and vaccine science and research. So we really appreciate the two clinical experts as well as the kids that are joining us today to share their experience. All right. With that, I'm going to jump into the questions for the panelists. And let's start out with the burning question, and this is for Dr. Cunningham and Dr. Johnson-Hooper. Should youth 12 and older receive the vaccine? So I'll start with Dr. Johnson-Hooper.
Oh, certainly. So most definitely, children 12 and older should receive the vaccine. You know, although fewer children have been infected with COVID-19 compared to adults, children can be infected with the virus that causes COVID-19. They certainly can get sick from COVID-19, and they spread COVID-19 to others. So it is important that they get this vaccine.
Okay. Dr. Cunningham, what are your thoughts on that?
I'm a big proponent of vaccinating these young adults. I worry about when they're with contact with their parents, grandparents, people who may have medical problems, maybe an aunt or a parent who had cancer. And I don't want to see them in the hospital either. While COVID hospitalization is pretty rare in children, there have been deaths from it. There have been kids who needed to be on heart-lung bypass because the disease was so severe and there was so much inflammation. And I want COVID to go away, and I want these kids to be able to be back in school in person. Not being in school has hurt them in terms of depression, anxiety, social isolation, and I want them to get back to life as we used to know it.
It's such a great, important comment. And I know it was such a relief when my son was able to get vaccinated. Tell me a little bit more about why the two of you decided to get your children vaccinated. I'll go back to Tisa.
Yeah, certainly. You know, for just the kind of that selfish reason, really for my family. Our family, there are 3 kids and my husband and I, but my mother is very active in our lives. So she's a senior citizen with underlying health issues, typically involved in our day-to-day life. And, you know, I was anxious to get the vaccine for myself and for my kids, really to make sure my mother stayed safe. I thought it was important to get vaccinated because I see patients every single day. I care for my patients and their family. I did not want to, you know, spread COVID to my patients. So I care about my family, my patients, my community. It was important.
And Dennis, your thoughts? Did you have any concerns about getting your son vaccinated?
Absolutely not. And my older daughter, who's 16, she was vaccinated as well earlier. I feel a little safer with them going out in public as we start to go back to restaurants, we go back to the stores. To me, it's a safety net, not only for them, but for the general community. When grandma comes over, I like knowing that we're not going to give her COVID and make her underlying lung problems worse. I just want my family to be healthy and happy, as we all want our families to be. And I thought this was a great way to do it. The science and the safety looked great, and I had no problem giving it.
That's great. So I'm going to ask this question of the kids on the call today. Do young people want to be vaccinated? I'll start from the youngest to oldest, and then we'll go backwards on the next question. So I believe that would be Madeline would be the first one to say, you know, do young people want to be vaccinated?
Yes. For me, everyone in my class and grade wanted to be vaccinated at my school, and a lot of the kids in my classes have been getting their vaccines because it's important to get back to normal for everyone. So really, most of the people I know have gotten their first vaccine or both or are wanting to.
And what about you, Brett? What are your thoughts? And maybe tell us a little bit, too, about the experience of getting vaccinated while you're answering that question. What was the experience like?
Some of my friends want to get vaccinated, some of them don't. I think it's just because they don't want to have the side effects from it.
Yeah.
But when I got vaccinated, it wasn't that bad.
Did you experience any side effects at all?
My arm kind of hurt the both times I got vaccinated, and I felt kind of crummy for a day, and that's about it.
Great. Aiden, what was your experience with getting vaccinated, and what do you think kids are thinking about with vaccination right now?
I felt perfectly fine after it, honestly. The side effects are truly minimal and no worse than any other seasonal flu vaccine or something along those lines. And I think just especially being in high school now, there's a lot more opportunities and a lot more socialization that happens with especially sports, jobs, any like high school events and whatnot. And I think people are really wanting to go back to those, especially like the high school experience essentially. So I was happy to hear that a lot of my class has already been fully vaccinated and along or in the process of it.
Well, I think sports is such a really, really big thing, especially for kids. And, you know, we certainly heard in this last surge that a lot of it was probably driven by unmasked indoor sports activity amongst our young folks. And we were really lucky today that we have Pistons legend who's joining us today. Earl Cureton, are you on the call? I think you might be on the call now. I don't know how we can get him onto the stage here. Mr. Cureton, are you there? Just to introduce him, he's a native Detroiter. He's a Pistons veteran. He's been a community ambassador for the Pistons, and he's really been helpful for us in the health system, really spreading the word on our family vaccination day at the Pistons Performance Center, and has really been wonderful in being an advocate for vaccination in the community. So I thought Earl was on today.
Yes, I'm here.
Wonderful. Would you maybe provide us, you know, your views and what message can you share to Henry Ford, our team members, and the kids and parents that are on this call?
Well, I just think it's, extremely important to get it done. As we can see the numbers and listen to the science and everything that they're saying, the shot is going to definitely help you. I got vaccinated back in February. My whole family, my daughter was able to get it. She has some pre-existing stuff going on with her, but it's just it was peace of mind after it happened. It was really no complications behind getting the shot. I got both of them. Didn't really get sick or anything like that. Nothing that I couldn't bear. But at the end of the day, you're able to be a little bit more comfortable out in the public. And as you can see, the more people that do it, the better chances of us getting back to being normal again. And for kids are extra active. In terms of going to school, in terms of playing sports, in terms of being out there, and they got a bigger chance of catching something than adults do. So I think it's extremely important for them to go get the shot, get it done. Not only to protect themselves, but to protect others as well.
Really great. It's such a great message. We really appreciate you joining us. And again, I think the message, especially for young athletes, is really, really critical, since we saw that so much activity around the young athletes, especially unvaccinated folks. So we appreciate it. I wanted to make sure that we kind of talk about the 800-pound gorilla. I think a lot of the patients that we run into are really concerned about safety. So, I'll start with Dr. Cunningham. Can you talk about the vaccine trial process and, how, you hear that a lot from patients. It hasn't been around long enough, and how can it be safe? How would you address that?
Sure. The first thing I would say, the technology that is in the Pfizer vaccine, they're called messenger RNA vaccines. This technology is not new. It's been used over 10 years. Anytime you read in the news about cancer immunotherapy, where you trigger your white blood cells to fight the cancer, those are mRNA vaccines, just like Pfizer. So this virus was rapidly identified. The manufacturers were able to take an existing process and just put that virus in to make it fight against COVID. The trials in people where we look at safety and efficacy were not rushed. It starts with phase 1, a small group of people looking for safety. And we're talking maybe 20 to 50 people. Phase 2, less than 100 people. You're still looking for safety, but also efficacy. And then we go to phase 3. And in the United States, I believe there were roughly 120,000 people in the phase 3 trial. Initially, half of them get the vaccine, half of them get a placebo or just a saltwater injection, so that you can know no one's bias comes into it. And the data was outstanding. The efficacy of this vaccine, it is one of the best that we have out there. The safety profile, it's great. Yes, people can get some side effects afterwards, but I'd rather my son have a day of feeling crummy after each of those 2 vaccines, knowing that he's not going to be sick for 2 weeks with COVID or wind up in the hospital or give it to someone else.
Great. Thank you for that. And Dr. Hooper Johnson, if you could, or Johnson-Hooper, if you could please comment on that as well too, but also maybe speak a little bit about, clinical trials, being the leader for pediatrics for the health system. I know that Henry Ford's been involved in a lot of activity in that regard, and talk maybe about safety and about the clinical trial activity.
Right. Well, I definitely think Dr. Cunningham spoke very well, very clear to know that these vaccines, we're giving them out now only after they have been proven safe and effective. I think it's important for everyone to know there have been no corners cut, that we are now, Pfizer is eligible for children 12 and above, and Henry Ford, we are involved in a Kid Cove study. So this is a study called Kid Cove. It's open for children ages 6 months to 11 years old. Those kids are in good condition. The objective of the study is to evaluate the safety and efficacy of Moderna's vaccine, and it's to determine what is the safest and the most effective dose for those young children aged 6 to 11 years old. That's going on right now at Henry Ford. So this is the same vaccine that was granted emergency use authorization by the FDA for those adults that are 18 and older. So to date, we more than 30,000 adults and children older than the age of 12 have taken part in the research for Moderna's vaccine. Is proven to be safe, effective, and we know the short-term side effect profile. Moderna is very similar to Pfizer of, pain at the injection site. Some kids feel, not the greatest right after the vaccine. They may be a little bit more fatigued. Some kids will complain of a little nausea, headache. These are symptoms that are typically a little bit worse after the second dose over the first dose, but those things like rest, ice at the site of the injection or Tylenol are widely effective to mitigate all those side effects. Rarely do kids have to avoid their daily activity because of the vaccine.
Yeah. And it sounded like from the experience of the kids on this call too, you all did pretty well. I know Brett shared his experience. Madeline, how did you feel after the vaccine? Did you have a lot of side effects?
I just had a bit of like a sore arm and I was just tired afterwards. So nothing really weird or out of the ordinary. So
That's good. And Aiden, you're the same way. I know you felt
Yeah.
pretty good
Yeah.
after the jokes as well. Well, good. So I appreciate you bringing up the side effects. That's certainly one of the things that people are concerned about. You hear a lot about parents saying, well, we don't know, what about the long-term side effects? And, again, especially with, let's say, female youth, people are concerned about maybe it's going to impact fertility or in our young patients. So, Dr. Cunningham, what would you say when somebody says that the vaccines could cause infertility and I'm concerned about giving it to my daughter?
So there's absolutely no suggestion in the science that these vaccines are going to impact fertility. In fact, in the Pfizer phase 3 trial, there were 25 women who got the vaccine candidate. They became pregnant in that trial. So that's certainly not a problem. When you look in animal models, there's no problem. This rumor came out from a disgruntled employee who used to work for Pfizer, who wrote a letter, and it was just picked up on the media. And not everything we see on the news is necessarily true, but I have no concerns about the fertility. There's no signs there. And in fact, we do know that COVID in pregnant women, they can get sicker. It can make the baby sick, possibly even cause premature birth. So I think this is a way to help people to have their children and keep their children safe.
Mm-hmm.
Great comment. Dr. Johnson-Hooper, anything you want to add in regards to long-term concerns?
Certainly. And that's a question that's raised often enough, saying, gosh, well, what will happen to me down the line? And I think one way to answer that is, when folks think that this vaccine is new, as Dr. Cunningham had mentioned before, messenger RNAs, that's what the Pfizer vaccine and Moderna vaccines or messenger RNA vaccines, they've been researched for decades. So this technology has been used in influenza, Zika, rabies, even cancer research, as Dr. Cunningham alluded to, and we certainly know those long-term effects. And more importantly, what we do know, and decades of experience with vaccine has informed us, that unknown delayed side effects, if any, show up within 2 months of the vaccine. So we have many, many months of administering these vaccines and know the side effect profile that occurs. So again, these vaccines are safe and effective, and to be concerned about a long-term, consequence of these vaccines, families just don't need to be.
Yeah, that's so important. I wanted to make sure to engage the audience to say, if you have any questions for the chat box, please feel free to put those in the chat box. We are, again, taping this webinar, so I'm sure we'll often get feedback following it, but feel free to ask some questions now. With that, I wanted to ask the kids, I'm going to pivot a little bit from asking your parents a question. One of the things we were talking about as we prepared for this session was the impact of social media on the information that you all receive that might make you concerned about the vaccine. And so we were kind of interested in hearing, where did you hear about COVID and vaccination? And maybe it was from your parents talking at the dinner table, I don't know. But we're interested in hearing a little bit about, Brett, Madeline, Aiden, what are you hearing in your social networks about vaccination, pro and con around vaccination? So I'm not sure who wants to answer, but feel free to offer up something. Brett, I heard you're talkative, so I feel like you should offer.
I mostly heard stuff from my parents, and I heard things like vaccination numbers and like the outbreaks in India a lot. That's mainly the stuff I hear about on the news.
Did that make you more likely to want to get the vaccine, do you think?
Kind of, because I saw how the numbers were rising in India so quickly, and I know that the United States doesn't have that much of a population, but still, if something like that happened here, that'd be really bad.
Yeah, thanks. Madeline, do you have anything you want to add at all? Where did you hear about the vaccine, and have you heard things, pros and cons about it?
So about the social media side of it, I don't really pay attention to social media when it has to do with like COVID or the vaccine, because you never really know what experience someone has with it. So if someone's talking negatively about it, you wouldn't know if they know what they're talking about or if they're just spreading rumors. So I mostly find things out from my mom or from like sources I can trust and not just social media.
That's great. Ethan, what do you think? What are sources you can trust too? I'm interested in that, adding on to that comment.
Yeah, I know this question is kind of more focused around social media, but I actually think that kind of human interaction and like human social groups, or like not, I mean, human obviously, but like in person, more like closer social groups have more of an impact. And we've seen that with data too, like more hesitant groups have been getting vaccinated more because their friends, their close relatives have been getting vaccinated. And I think that does have more, that has a really significant impact, the human to human relationship, as well as social media, obviously, you know. And I think just, you know, people snapping a picture of their vaccination card, something like that is just really helpful. And it does get people, especially those who are not as sure about it, more into it, and maybe just getting it along with, again, all their close people, peers.
Yeah, I think you're speaking to peer pressure, you know, which I think we can experience when we're kids or we can experience as adults. I think that's a really important element of why we get vaccinated. You know, there's some great questions coming in the chat box. One of them I'm going to ask to Dr. Cunningham. I'll start with you. Can you speak to advice on getting the vaccine when the child is recovered from COVID? And thoughts on, do those folks have more severe side effects because the body's already been exposed to the virus?
So I would still recommend getting the vaccine. We know that after natural infection, antibodies or protective proteins, they really peak around 6 weeks and they start dropping dramatically after 3 months. The vaccine antibodies or protective proteins seem to last a lot longer. The vaccine makes such a great immune response. This is such an effective vaccine. I also believe it gives you better cross protection against the different variants or slightly mutated COVID strains there. So anyone who's had COVID, kids or adults, I recommend the vaccine. Will they get more severe side effects? They may have a little bit more intense achiness, chills, possibly even a fever because they've been exposed before. But every time they're getting exposed to this, the immune system's ramping up even more. So it just is giving you one heck of a booster dose for protection long term.
Great. That's a great way to describe it. Thanks. There's another really great question in the chat box that I'll direct to Dr. Johnson-Hooper. So the question is, what are the numbers in children not vaccinated that catch COVID, experience extreme sickness and hospitalization? So I think it's speaking to, you know, how sick do kids really get when they get COVID? And then this follow-up question to that, which probably leads to that, is why should I vaccinate our children if I'm vaccinated and the entire adult family, like my grandmother, are vaccinated? So that's a really great question. I appreciate you asking it, Nick.
That is a really good question. I think, you know, when we're talking about COVID and COVID vaccine, we've spoken about what we know and what we don't know. And what we know is, by and large, children, when they get COVID-19 virus, they don't get as sick. Now, there are children who have underlying health issues that put them at risk of severe disease. And I think oftentimes when you think of children, you think that children generally are healthy. Well, I would like to believe that all children are healthy, but that's just not the case. And so we have a large number of children with underlying health issues like asthma. It's really common. Obesity, diabetes, autoimmune disorders. I mean, these are significant chronic illnesses that if these children would contract COVID, they're at risk for severe illness, hospitalization, ICU, and unfortunately death. So that is one reason to recognize that not everyone is a healthy kiddo, that if they get COVID, it's likely not to be as severe. But what we don't know is we really haven't unpacked or determined really what are the full long-term consequences even of a mild case of COVID. So we've certainly seen people suffer from longness. There's no way to predict. who's going to have a mild, uncomplicated case and who's going to have those long-term consequences. I'd also like for folks to think about, and it sounded like this question in that nuclear family, everyone is vaccinated. But unless and until we have a large population of vaccinated folks, and if by unfortunate chance we have a resurgence of the prevalence of this virus in our community, we're going to be back to what we didn't want, right? And I think we're focusing on the infection. We haven't focused on the impact of COVID on kids' socialization, their mental health, right? We haven't focused on the academic struggles, academic failures that we've seen in these kids. We haven't talked about the long-term consequences of that. So that's something that I think we really, as it pertains to that pediatric population, we really need to focus. We don't know what the consequence of COVID is on those issues. And I think that we need to put that in the forefront and not just talk about a couple days of not feeling so great.
I would also add that some healthy kids have been hospitalized with COVID. If a child needs the hospital because of COVID infection, about 1 in 3 wind up needing intensive care, which is no place I want to ever see my children or anyone's children for that matter. And this is a very rare side effect, but there's something called MISC, multi-system inflammatory syndrome in children. At one time, Michigan had 50 kids admitted throughout the state for this disease. They wind up in the hospital. Their immune system is just revving to go, and it starts attacking the body. 12% of those kids actually wound up on a heart-lung bypass machine. They can have long-term problems for the rest of their life. The problem, as Dr. Johnson-Hooper mentioned, I can't tell you that your child's going to be fine, but your child's going to have a long-term problem. We just don't understand to that degree. So that's why I think it's so important for everyone to get vaccinated. And masks do work, but what happens to masks when the kids are eating lunch at school? So that's another reason why I was really happy that Brett and my daughter Megan were able to get the vaccine.
That's great information. Thank you guys so much. Another great question from Nick in the chat box. Does the mRNA vaccine suppress the immune system in the future for simple viruses or colds? So do we get an additional benefit from that mRNA vaccine? And I see Dr. Cunningham shaking his head, so I'm going to go to you, Dennis. I know it's hard for you to not answer that question because
I love immunology. So this vaccine, this messenger RNA doesn't last a long time in your body. It doesn't enter our genetic code, doesn't even come near our DNA. And it just produces in our cells the spike protein from the virus, and that's what we mount the antibody response. This will not make you more or less susceptible to other infections. It's just going to help protect you against the COVID virus.
That's great. So Dr. Johnson-Hooper, one of the areas too I wanted to ask about because of your area of expertise is around parents for parents of special needs kids, kids with allergies. What should they know about the vaccine? What should they be thinking?
Certainly. So the one thing is, there are a lot of children with allergies to like plants or food or pets. Parents should know that the COVID-19 vaccine are safe for those children with allergy history. So they definitely should get the vaccine. I do care for a lot of children with special health care needs. And whether it's the underlying diagnoses I've spoken of before, a special population of those children with developmental disabilities. And I'll be clear, the developmental disability doesn't cause that child to be at more risk for COVID. They're just more at risk of contracting because they may not be able to adhere to the social distancing. They may not be able to adhere to wearing a mask, washing their hands frequently, or avoiding touching their nose, eyes, and mouth. So these are things that we want folks to do to help reduce, from contracting. And so from having that developmental disability, like intellectual impairment or autism spectrum disorder, those kids may be at risk, more at risk of contracting the virus. And for the reasons we spoke of before, that then just because if they get the virus, they then are at risk of just a mild case or a severe case we cannot predict.
And a follow-up question to that just appeared in the chat box. Are there any studies on the vaccine in children suffering from ADHD or ADD? Are there any studies? I'm not sure if they've studied particularly that
Yeah.
patient population.
They have not looked specifically at children with ADHD. I will tell you, in the population, it represents, the general population as a whole. So confident there were some children who, had ADHD, or children with asthma, or children, healthy kids, but not specifically. I do not know of any study that looked specifically at COVID vaccines and ADHD.
And I wouldn't expect it to make any difference. Kids with attention deficit disorder have normal immune systems, so they should be the same as children without ADD.
So we're getting close to the end here. There's a couple other questions in the chat box that I'll address. I'm interested in this question, though, because, we're at the end of the school year. We're going to be having a wonderful summer, hopefully, where people get to get outdoors. COVID cases are down. Fall's going to come again. And I'm interested in the kids' take. Do you think the schools should mandate having a COVID vaccine for kids coming back to school? And then I'm going to ask that of the parents as well. So, Madeline, what do you think? Do you think that's a tough question to ask a kid? We're not going to hold you to it. But do you think that should be a requirement?
Yes and no, because I do think it's important for people to get the vaccine. Really important for people to get the vaccine. I'm also not sure, because some people might not be able to get it at before, they might not be able to get it before school starts. And if they're not able to go back to school because they weren't able to get their vaccine before school started, that'd be really sad.
So wise answer. Brett, what do you think?
I think they should be because if there's a COVID outbreak and you have to learn from virtual or something like that, I feel like it's a lot harder to learn for a lot of kids. So I think that it would just make more sense to have people vaccinated.
Great comment. What do you think, Aiden?
Well, for sure. I mean, I think obviously it's very important, obviously to get vaccinated, of course, but I think maybe the schools could consider record who has been vaccinated and verify it. But I think maybe forcing it, or maybe punishing because of not getting a vaccine might go into some murky water. Maybe not the best to encourage people or make people feel so safe about these vaccines. I think maybe more of a reward system. If you do get vaccinated, maybe you can go to these events, or you don't have to wear a mask in school or whatnot. So I think maybe taking a more rewarding, less punishing approach would be the best option, especially for kids who, I think by September, if you haven't been vaccinated, you must be either really on the fence or in a really maybe more contentious position. So I think for those people who haven't been vaccinated yet, all the way in the fall, there might need to be more encouragement and less punishment.
Would a free school lunch be a reward or punishment? It'd be hard to know. So Dennis and Tisa, what are your thoughts on should schools require the vaccine in the fall?
Well, I will say that my job is, as a physician and someone who's done vaccine research, I will interpret the data, I will answer questions. Whether it's going to be mandated is really a government issue by elected officials and the schools. It becomes a struggle between the individual rights and then the social benefit. As Brett alluded to, if we don't have school, that hurts everybody. So there's a public health benefit to vaccination, but Americans, we really enjoy our independence or our autonomy. So personally, I would like to see it done, but as a physician, I'm not really sure I could say that.
Dr. Johnson-Hooper, what do you think?
So I'm the last one. I think if I'm held to it, I'm going to be in the camp of requiring the vaccine, and I think it's really my lived experience this year. It's been really a horrific year, and there isn't a day that I don't see kids coming in that I see kids having gained 20, 30, 40 pounds, elementary school students this year because they've been holed up in their house on the screen all day. I see kids who have now really bad sleep issues, a lot of anxiety, a lot of depression, We've had kids hospitalized because of suicidal ideation and suicide attempt. I think the consequence on kids day to day, again, we have not focused on. And when you look at these significant outcomes, that which we do not know the long-term consequence of, that is far more significant for me than, and I appreciate, that individual decision, but I think collectively we're going to be in a world of hurt if we have to keep going through this, season after season. It's a vaccine that's safe and effective. And for that reason, the risk of the vaccine so low, I would require it.
And that's another story. Not only those issues that you're discussing, but for many children, they lost a year of learning.
Yes.
For kids who struggle academically, that is going to really hurt their academics for the rest of their life.
And many schools have no plan to catch them up next year, right? That's what I'm talking about, this long-term consequence. We haven't really seen the impact, the full impact of it. And it is going to be a challenge for many school-age children.
Well, all really, really great answers for a difficult situation. And you're in a crisis when there's no good answers, when all the answers are difficult, when all the answers are difficult. So I really appreciate your thoughtfulness. Well, with that, I want to be sensitive to folks' time. One other question in the chat box, can you speak to concerns about male infertility? I believe it's also greater with COVID than it is then with getting the vaccine. And I'll just take that one really quick because we talked about it in the infertility webinar, which is a great other webinar if you get a chance to look. There's no association between the vaccine and male infertility. There is some research that's currently out, again, talking about the impact of the virus on various parts of the body, one of those being the male reproductive tract. So again, another opportunity for us to really think about the benefits of the vaccination to help prevent the disease itself. But with that, so again, I just wanted to thank everybody. I know that it's a school night, so there's probably lots that our kids need to get back to doing. I really want to thank Dr. Cunningham, Dr. Johnson-Hooper, Madeline, Brett, Aiden for joining us this evening. Again, just to remind folks, if you have any other questions, put them in the chat box. We will get our experts to answer them for you. We'll put them on the One Henry vaccine page, and then also when we publish this on our YouTube page, you'll be able to see those questions. For those folks that are employees, this webinar is going to be shared in the Morning Post and on our One Henry vaccine page. So look for it. It should be up next week. And then we'll also usually do a frequently asked question, one-page PDF, so that folks can print that off and share that widely with folks. But again, really appreciate everybody's time today, your great answers, thoughtfulness, and really appreciate the kids today and having their insight and their input as well, too. Great. Thanks, everybody.